every couple of decades, we seem to be thinking that we can tackle a given issue in a very vertical manner. So doing lots of research, into new therapeutics and diagnostics and vaccines. And then when it comes to implementation, thinking that we can just sort of parachute ourselves into a given system and improve the way, patients are treated with the infection. And when it comes to AMR, when you think through the interventions that really make a difference, these are, good surveillance, good infection prevention and control, good supply chains. So we really need to have the systems in place in order to make sure that these drugs last as long as they can possibly last. And that's not through coming at this, from just a research approach or a very vertical program approach. It's really through strengthening the system as a whole. Well, I think there's one thing that certainly makes action on antimicrobial resistance very difficult, is that we have framed it really as, as we do sort of in basic sciences or in microbiology. We frame everything around the microbe. And then we expect that everyone will understand what we're talking about when it comes to implementation of measures, when actually there's a pretty, there's a disconnect between when we're talking about the microbiology and when we're talking about the clinical relevance, right? You could have all the resistance genes in the world, but if they're not expressed, then there's no clinical relevance there. So it's as if we're taking a microbiological issue and we're trying to shove it into the clinical realm. And we may need some translation somewhere in the space between them. So perhaps, talk instead about the treatability of infection, something that has some clinical relevance that people outside the research community can understand. And that could, potentially help, improve the chances of measures being implemented. Because right now, in the vast majority of countries in the world, the national action plans on AMR are not being implemented. So we need something to change. And it's not just about funding. It's also about understanding the issue and how we can act. But putting it in clinical terms would be really helpful.
And if I may add, this also ties to the misconception about what is prevalence of resistance and what is actually burden, and this clinical relevance. So what are the deaths caused by these resistant microorganisms and what is the disability caused by them? So I think this ties nicely to your point that we also have to look at the clinical relevance of resistance. Maybe like a hidden issue during the COVID pandemic, and now we are facing a lot of problems with AMR. And of course, one of the pivotal steps what ESCMID did was forming this subcommittee. This basically enabled more communication with other stakeholders that are relevant in the field, such as WHO, or World Health Organization, such as European Center for Disease Control. And we plan to broaden this network and in a way have more impact in the policy realm. So what we want is not only to focus our efforts on research, but also translate to policy relevant and actionable insights. And I think ESCMID will have an increasingly important role here in the future. And I think getting back to the point of the relevance and importance of the problem, when we look at the burden numbers, each year AMR, according to the newest estimates, is responsible for 1.2 million deaths directly attributable to this resistant only bacteria. So it's a huge issue, and I think ESCMID will have an increasingly important role, not only by organizing World Antimicrobial Awareness Week, but also webinars through the years, communicating with different stakeholders, a lot of different educational activities, and of course reaching to the public as well.